Good evening, everybody. Good evening, Audrey.
Hi there.
We're really looking forward to this evening. We're just going to give everybody a minute to come in. So welcome to the Ikigai Webinar series. We're actually in our 90th webinar now.
Ooh.
Over the last 5 years, we've run so many. So different topics, and this is very different for us, Audrey, this evening.
I hope it will open a few eyes, Siobhan. I know I had my eyes open with it, so I'm hoping it's going to open a few eyes. I'm very pleased you invited me along. Yeah.
Yeah.
Where did you
Great.
see about me, Siobhan? How did you come across me?
Through Kat Edney on the Dental Hygiene and Therapy Forum.
Okay.
Kat connected
That's
them.
interesting.
Yeah.
Right. I don't know how I ended up on that forum. Somebody must have invited me. Okay. Yeah. No, that's
Yeah.
great. So we're just waiting to see maybe a few more coming in
Just
and then we'll
one
get
one more
started.
minute, yeah, while
Yeah,
give
we've
people
got
just a
50
chance to
people.
come
We've
in.
got 50 people, so that's absolutely
Well,
brilliant. And there's probably going to be quite a few more join as we go along.
yeah, there will be. Yeah. So at the end of this webinar, there will be a link that I'll put into the chat, and there will be a QR code, and that way you can answer the question straight away. Make sure that you click the little buttons that you're asked for, and your certificate will be issued straight away. Now, the thing is, I've just had a couple of people in the week where it's just gone into the junk. So please just check your emails around for those. And that should be there with you. The certificate should be in your email list. So check around. So as I'll just, before we start, just say that again, if that's okay with you, Audrey.
Brilliant.
And we are delighted to have Audrey Kershaw here this evening. She is an oral surgeon. She travels all across Scotland. I'm not going to say too much because I know that you're going to be telling your journey, Audrey, and exactly what you do.
No, that's great.
So just to say again, when it comes to the CPD certificates, at the end, there'll be a QR code and a link. So we will do it straight away, answer the questions, tick the little boxes, and if your certificate doesn't come into your inbox, please check the junk and the spam, and your certificate will be there. This will be available on demand in about 7 to 10 days on the My NSK website. So thank you for joining us, and I'm going to hand you straight over to Audrey. Thank you very much.
So thank you very much. I'm just seeing, being nosy, how many people. We've got 60 people so far. So thank you so much on this very cold night. I've got another couple of helpers. You'll see them jump on the couch later on. So we're starting off at 4 minutes here. So I'll try to keep to time, Siobhan, but we've got loads of time for questions. I'll stay as long as we've got questions at the end. So this might be completely new to some of you. You might just be here for the CPD points. That's absolutely wonderful. Some of you might have heard of this from all our social media posts and whatever. But anyway, we will get started. So thank you for coming along. This is a very misunderstood and underdiagnosed condition. And I want to show you how relevant it is to us all in dentistry on a daily basis. So there's no point in me doing this live unless you all think of your questions and ask them to us at the end. So I'll be very happy to answer everything. So this is something that gets people thinking. It wasn't me that made it. When you can't connect the issues, think connective tissues. It's when those patients that, you know, there's something wrong and we just can't figure it out. Well, I'll probably hopefully shed some light on it tonight. So what is the problem? Rodney Graham, a rheumatologist, once said, no other condition in the history of modern medicine has been neglected in such a way as Ehlers-Danlos syndromes. So what we want to do tonight is to open your eyes to what might be going on. And I know in my journey with this, I really have had my eyes open. This is just a quick whiz through an introduction, and we're happy to organise any other sessions that anybody would like. Expected learning outcomes, I'll let you all read those for yourself. So this is myself. I'm Audrey Kershaw. I qualified in 1987. I'm a specialist in oral surgery, and as Siobhan said, I now work all over Scotland. I did a lot of Max Fax jobs to begin with. I then taught in Dundee Dental School, taught oral surgery, medicine and surgery, and I'm now peripatetic, as I said, working around Scotland. Quite funny that just before I was asked to do this talk, I came across a book called Ikigai. You're supposed to say it in the Japanese way. And I know your, whatever it is, who've asked me to do this talk, that is the name of your place. And that means finding a purpose in life. And with Ehlers-Danlos syndromes and connective tissue disorders, I've absolutely found my purpose in life, and that is to help spread the word on this and to change lives. Quite often in these talks, and I'm going to be joined by Alan Hakim, who is the worldwide lead really on Ehlers-Danlos syndromes, and he's joining me for a British Dental Association talk in November. You're all welcome to join that as well as you like. And quite often we're joined by Linda Bluestein. Linda, I think she's done more for Ehlers-Danlos than anybody else in the world. Absolutely brilliant website, and we're giving you the references to all this at the end. Linda has got about 180 podcasts on everything EDS. Okay. So these poodles are not just up for the sake of it. They've actually jumped onto the other couch. Otherwise, you should have been able to see them sitting behind me here. These are my two poodles. Before I got poodles, I'd never noticed poodles anywhere. But once you're made aware of something, you then see these things everywhere. Now I see so many poodles or poodle crosses, and I'm not imagining these poodles. They are actually there. I'm not making it up. And they were always there, the same as Ehlers-Danlos syndromes, but I just wasn't seeing them. And I wonder if you guys weren't seeing them either. So I want to share with you my experience of Ehlers-Danlos. So what am I talking about? We will use these terms, we will change them about throughout the talk, because this is how it's done in the literature and everything else. They can be called hypermobility syndromes, hereditary connective tissue disorders. There's over 100 of these. Ehlers-Danlos, hypermobility spectrum disorder. So don't worry about us changing the names. It all sort of just means the same, and we're not really sure what people have got sometimes, but just assume it's all just about the same. So what are hypermobility syndromes? They're a collection of genetic collagen disorders. And as you probably know, collagen is a protein. It makes the main building block of the body. And so every body system is affected if you have got dodgy collagen, for want of a better word. It tends to be an invisible illness. So individuals often look really, really well, and they're not believed that they're ill. So this is a breakdown of what were the different types of Ehlers-Danlos syndromes from the 2017 classification. Up until 2017, there were only 6 types. By 2017, there were 13. By 2018, there were 14. I think there's now about 22. What's important about this is they've all got different names, and some of them are dominant and some of them are recessive. So the dominant ones means you just need one parent to have it, and then you've got a 50% chance of having it. Recessive ones tend to be a bit rarer, and you need to get both of the genes. Other important thing about this is all of them have got a type of collagen known to cause the problem and the genetic basis, all apart from the most common type, which is the hypermobile type. So most of the ones we find are hypermobile types, but a colleague of mine, osteopath colleague Janet, and myself, we do pick up rarer types as well, pick up classical-like, vascular, arthrochalasia. So don't just think because hypermobile is the most common, it's going to be that. So my experience of Ehlers-Danlos, I don't know about you guys, but do you know, I always knew there was something going on that I was not understanding about these cases up until 2018. And then I suddenly found the answer from a friend. Yep, that she started a conversation about Ehlers-Danlos, a medical friend of mine. Then I counted up my figures of what goes on. By 2024, I was seeing about 1 in 8 of my cases as undiagnosed connective tissue disorders. Now, for some of you, that might just sound absolutely crazy. Who is this woman who's talking from Dundee in front of her wood-burning stove? That is what I see. I have never knowingly picked up a case and I've been wrong. and almost all of them have gone on to get a diagnosis. So 1 in 8. We've got to remember that I don't see a representative sample of the population. And we've also got to remember my character type, I'm very cautious. I won't just come out and say something's whatever. I will absolutely make sure. So last year, for example, I picked up 120 cases. I work as a specialist oral surgeon, so I tend to get the more difficult cases referred to me. As we all probably know as well, oral medicine waiting lists are huge. We're a bit short of maybe specialists in some bit of the country, so I do see quite a bit of oral medicine as well, and a lot of these actually turn out to be undiagnosed connective tissue disorders. So that's, yeah. So the prevalence of Ehlers-Danlos, I'm saying I'm finding 1 in 8. 2016, before I discovered about Ehlers-Danlos, it was supposedly worldwide 1 in 3,000 to 5,000 patients had undiagnosed EDS. We're concentrating on EDS here because this is the most common connective tissue disorder, but just keep an open mind. By 2019, a Welsh study had shown 1 in 500 to 1 in 800. And then 2024, a northeast of England study showed 1 in 227. We have got other people that agree with me. It's much, much more common. These are only the ones that have been picked up and diagnosed. And Sally Pizarro, professor midwife, she will say as well, she thinks it's more like 1 in 20 or 1 in 30 actually have an undiagnosed connective tissue disorder. People will be affected to different degrees, but anyway, much, much more common than we think. So now everywhere I go, I see poodles. This is not a mirror image. This is actually a real picture when we were out for a day during COVID. These are my two on the right, and we bumped into a couple of females on the left. So everywhere I go, and this is the same as with Ehlers-Danlos. On my clinics, it's unbelievable the number of people that come in to see me with Ehlers-Danlos. We don't have a neon light flashing above saying Ehlers-Danlos, come in here. It just happens. So you're maybe thinking, is this really relevant to us, Audrey? Come on, what are we wasting our Thursday nights for? Well, it is. What I said before was, do you know those cases you couldn't quite figure out what was going on? The local anaesthetic wouldn't work. The patient was really anxious. The mucosa seems a bit more fragile. They bleed easily. They bruise easily. They tend to get more TMD, headaches, migraines. Facial pain seems to be different. They get a lot of developmental dental defects, the white spots in the teeth, fast and painful orthodontic treatment. They tend to have a lower pain threshold as well, but they can put up with so much more pain. And then they have all the other associated medical issues that we'll go on and talk about a little bit later on as well. So it really is very, very relevant to our day-to-day work. So when do I find the cases? Okay, so first of all, maybe in the younger patients when they come in to have their first molars removed because the parents haven't been looking after these teeth and their first molars have gone carious. Well, a lot of these we find they were actually developmental dental defects in the first molars. And the number of parents I've had to say, would you stop beating yourself up about this? Because I think these were poorly formed and it wasn't your fault necessarily that these have decayed. Orthodontic extractions, quite often get them referred, oh, the patient is far too nervous and anxious. Well, a lot of them, and you can tell I get really annoyed about this, a lot of them, the local hasn't worked. And so the patient is feeling it's sore. And it's not just that way when you're trying to take out a tooth. And I've had it for a lot of my career. Your assistant is saying, you can't be feeling it's sore, it's just pushing. So a lot of these come to me because they are labelled as far too difficult and they're just anxious. Wisdom tooth removal. I see a lot of wisdom teeth. With wisdom teeth removal, again, we maybe pick up some things in the medical history that we'll go on to later on. The patient is anxious, maybe local doesn't work. We see a lot of people for anxiety. Well, with Ehlers-Danlos, the patients are anxious because that is just how they're made. But if they've maybe had dental treatment done in the past and they've not been numb and they've told by the dentist that they're just being silly, the dentist, therapist, hygienist, whoever, that they're just being silly, pull themselves together, it can't be sore, they're going to be even more anxious when they come in to see us. Yep. A lot are referred to me for sedation. I don't actually do any sedation because my patients just, when we've listened to them, understood them, they shrug their shoulders and just say, get on with it, I'm fine. TMDs, almost every TMD case I see is an undiagnosed connective tissue disorder. I picked up this week, to keep confidentiality, I picked up a 13-year-old girl who was in for an exposure of a canine tooth. And she said, oh, can I just say I don't want to open far too wide because my jaw joint comes out of place. And she's got reflux and she's got IBS and she's got headaches. It's just, that was another one we picked up yesterday. Facial pain, we're seeing more and more of this, and they're undiagnosed EDS. Halitosis, the people that work with me, I talk too much, I tell too many stories, but we're sort of to time. I get these weird and wonderful cases referred to me, and my nurses are absolutely brilliant. My nurses are great with me, and we can just talk. And I say, what's the dentist referred this case? Why has the patient found me on Google and referred themselves to me? It was a 54-year-old lady with halitosis. She had been seen by everyone. She'd had this since she was 14, ENT, gastroenterology, oral medicine, seen by everyone, and she was just at her wit's end. For 40 years it had affected her marriage, her job, everything. And she actually was an undiagnosed Ehlers-Danlos. She had the halitosis because of the gut issues and the acid issues. And it was absolutely life-changing. She was an absolutely amazing woman, that a lot of the Ehlers-Danlos cases are, and she was absolutely so grateful. Interestingly, she had two daughters. One of her daughters in her 20s also had the halitosis, and so we changed another life in her. And the other daughter had also very, very bendy joints. So that was a whole family. And they're really quite funny because one of the daughters came in to see me for a wisdom tooth, and the three of them came along with one of their babies as well. And they're sitting in the waiting room, and they were not going to keep their mouths shut. And they were just telling everybody else in the waiting room what I had picked up in this mother before. And it was quite funny because there was a patient sitting there who was my next patient who had no idea about Ehlers-Danlos. She'd already had the talk from this 54-year-old woman and her daughters, and she came in to see me, and I said, I think you're undiagnosed Ehlers-Danlos. But she'd already heard about it from this woman out in the waiting room. So it is absolutely brilliant to be able to change things. Yep. So some of the people that could come into your surgery, Russell Kane, Billie Eilish, yep, all of these people have got Ehlers-Danlos syndrome or hypermobility spectrum disorder. I had a really lovely 15-year-old girl in another practice a couple of weeks ago, and she was needing her sixes out because they were grossly carious. They decided they couldn't afford to see me, so they cancelled, and I phoned up the mum and I said, I really think I'm seeing things in the medical history. Will you please just come and see me for a chat? And she came in with her daughter, 15 years old. She had her earphones in, and I was sure she had Ehlers-Danlos. And to get my story across, I said, do you know people like Sia and Billy? And she said, I'm listening to Billy at the moment. And I said, well, you and Billy have probably got much more in common than you had ever realised. So, that's just some of the people that with it. And a lot of you maybe didn't even know these people were ill. Jamil, we mentioned Professor Graham earlier on, saying this was the most misunderstood condition. Jamil, I think at the age of 7 or 8, appears in his papers, scientific papers on Ehlers-Danlos. So really interesting just to open our minds, and we could have any of these people in to see us. So when to suspect, this is just a DPT. Most of the time, I know before I see the patient. I know when the patient is, the email comes into me. Normally, I don't have to have my eyes open now because the nurses, managers, reception staff are so clued into this. So this was a X-ray I received the night before I went down to the borders, and I thought, I think this is going to be an Ehlers-Danlos. And I don't know what you guys are seeing here, but it's like, why has this 15-year-old lost her first molar teeth? Oh, and another one is grossly carious. She's got an absent tooth, hypodontia. That is also a sign of Ehlers-Danlos. I felt these roots were maybe very, very long, and I felt there might have been a bit of torridism. Let's not argue whether there was or not. But this for her, this girl, 15-year-old, and her mother in her 50s was absolutely life-changing. And these people become your best supporters ever. And it has utterly changed their lives, as well as this girl's great aunt is 90. She can still put both feet behind her head, so they have mapped their family tree out with this. So, when to suspect, this is a little bit tongue-in-cheek, this one, okay? So this is the way our nurses, managers, treatment coordinators can pick cases up before I do, and they nudge me, okay? These are undiagnosed EDS cases, but they've already accommodated to a lot of their issues, okay? So in the waiting room, or even with colleagues, because a lot of dental nurses eventually come and say, Audrey, do you mind if we have a chat? If we've got 60 or so on, we've got 74 on the talk tonight. There are going to be some of you in our audience tonight that maybe this all rings true. Contact me and I'll be very happy to try and help you through it. Okay, so when do we suspect? They're anxious and sensitive. They're anxious in different ways. They phone up, oh, where do I park my car? Is it okay if I bring my shopping bags? They're very sensitive. They can be very lovely. They're overdressed for the weather. Yep, they're the ones that are always wearing the leggings. The nurse is always wearing the leggings and the long sleeve tops underneath their, yeah. They come in wearing hats and whatever else. Merino wool, they do like to wear very soft wool because they're very sensitive psychologically and physically. They can keep moving. I picked, I'm just trying to keep it all confidential. I like to go around charity shops when I go to different practices. There's one charity shop I go into often. And this guy in the charity shop, he can't stand still. He keeps moving from side to side. Now, a lot of you probably don't even realize you're doing that. And another thing is, lots of patients with Ehlers-Danlos, they have their arms crossed over their stomach and they have their legs intertwined. And the reason for doing that is to try to increase your blood pressure. If you move from side to side, you're getting your blood pressure back up so you're not going to faint. Yep, the same with the arms crossed. This is a great word. I'm not even going to try to pronounce it tonight, okay? They look younger. These are the patients you go out to the waiting room to bring in, and they look 10 years younger. White spots on the teeth. I picked a case up again this week. Almost every tooth in this girl's mouth had white spots on it. This was the same one who said, I don't want to open my mouth too wide because my jaw dislocates. So we're going to see her again to have a chat about it. They bruise and bleed easily. These are people, colleagues, friends, family members. It's like you say, where did you get that bruise from? What have you done? And they sort of look at you, then they look at their leg and they think, I had no idea I had that. These people can be clumsy. Yep, clumsy as children, clumsy as adults, because they've got poor proprioception. One nurse I work with, Ray, is absolutely brilliant. Absolutely brilliant. Helped me set all my services up. When we take the medical and social history, we ask what sort of hobbies you do. When he hears yoga or Pilates, he gets out my extra medical history form, raises his eyes, and we smile at each other. Lots of them, they don't drink, and they find caffeine quite difficult as well. So, you're sort of getting an idea of this, maybe, receptionist, nurse you work with, your friend at school. Yep. Dietary intolerances, a lot of them can't do wheat. They're dairy-free, wheat, some of them are vegan. They know what suits them and what doesn't. There's also something called the low FODMAP diet. So a lot of the time certain foods don't agree with them. Carry a large water bottle about with them because their blood pressure can be low, but it doesn't have to be low. I know somebody that was outed because of their large water bottle by a colleague who'd been to one of my talks. When I look down, see them sitting on the chair, you can sometimes see their thumbs are really bendy. I don't have very bendy thumbs, so I can't show you that, but they can have really bendy thumbs and fingers. And when they're sitting like this in the dental chair, you say, oh, excuse me, can I just ask? Yeah. Rab jackets. I know that's a bit of a funny one, but in the last talk I did in the Northeast, one of the girls afterwards contacted me and said she didn't realise she had Ehlers-Danlos until my talk, and she wants to send me a photograph of her 5 Rab jackets. It's really quite funny. So Rab jackets, they're made for climbers. So when you lift your arms up, the arms will still cover a good proportion of your wrists. Some people with Ehlers-Danlos, they can be tall and thin, but by no means everybody. And Rab jackets are made for people that are tall or thin. It's just a bit of a funny point. When we see somebody come into clinic with a Rab jacket on, we will make a little comment. That's a lovely jacket. How many do you have? And believe me, the number of times they turn out to be Ehlers-Danlos. This is Emma, who couldn't join us tonight. Okay, I suspected Emma had Ehlers-Danlos when I got a telephone call about her the day before I was due to go down to the borders. Okay, so she's a great example of the difference we can make, and she had many giveaway signs, and it wasn't taxing for any of us. So the referral said she's a 32-year-old woman. She's got problems with her TM joint, and she's got a Carius 3.8. Did you see Emma's absolutely wonderful skin there? She was anxious and tearful, but then it said she coped with dental treatment well. Well, come on, can we make up our minds? Was she anxious or what's going on here? But that is what it's like. She was very hesitant to seek help because she had been gaslit her whole life. Emma shares her story at the Scottish Dental Show with us. She's come on these talks with me. Very soon after meeting Emma, and I said to her, I thought I knew what was wrong, she just blurted out. Within about 2 minutes, she said, Audrey, if I can help you in any way, I am here. And she has stuck true to her word. Okay. So she also had big giveaways. She had gastric reflux, irritable bowel syndrome, functional nerve disorder, abnormal sugar levels. That wasn't taxing to me at all. And I would love for you guys to go back. And when you see your patients, just see these things and think, ah, right, that's what Audrey said. So Emma said she had a whole host of complicated health problems for over 20 years. The doctors had failed to diagnose her. She walked through my door and I instantly knew. Well, that's not true because I knew before I went down to see her. She was so emotional to finally sit in front of somebody who was listening and understanding and able to explain it to her. Yep. And Emma got it the minute I said, do you think your unconnected signs and symptoms could be connected? She genuinely cannot thank our team enough, and she's now empowered to understand her health now. Now, I think that is such a positive word, and there are so many of our patients that feel that way. They're not sitting around saying, poor me, why me? They're getting on with it. So Emma, very shortly into our consultation, she drew me this look and she said, so do you mean I had to come to the dentist to be told this? And I said, yeah, Emma, you did. She wasn't drawing me a look. She was drawing every other medical profession that had ever seen her a look. Yep. There is no place for doctor bashing here at all because I missed these cases for the first 30 years of my career. There's no place for doctor bashing. We can only see what we know about. Okay. I have an artist friend called Lincoln who has listened to me go on about this and the patients I pick up. Lincoln is an artist friend with no medical knowledge whatsoever. Lincoln has now picked up 3 cases of his own just by listening to people. And my hairdresser, Katie, who I said I mentioned in all these talks, Katie as a hairdresser has listened to me and she picks these up as well. So everybody in healthcare comes to this from different angles and we've all got chances to diagnose this, okay? So here's Alan Hakim looking at the knee joint. Let me get my mouse back. Alan Hakim looking at the knee joint. We have Tara Renton here, who I gave a talk for. She's trying to figure out what these things are. Are these actually canine teeth or what's going on? Dermatologist thinking, what is going on with this skin? And the GI surgeons thinking, what is the diarrhea and constipation issue here? So there are many chances to pick up these cases. And Emma, any of Emma's clinicians could have joined the dots. Okay, Emma even now spots cases herself and she very tactfully says to colleagues, listen, this is my story. I just wondered if I see something similar. This is nothing new, 400 BC. It was known about, okay. This is a poodle. when I went to dental school in 1980s, this is what a poodle looked like. And I'm sorry you can't see my poodles, but they're on the other couch, comatose. This is what a poodle looked like. My children would never forgive me if I had my poodles looking like this. Okay, and it's a similar story with EDS. When I was at dental school, and I was still like this when my friend Joy said to me in 2017, it was blue sclera, stretchy skin, and mobile joints. This is one of the rarer forms of Ehlers-Danlos, and this is not like what most of them look like, okay? And it's only part of the story. So, as we said, Ehlers-Danlos is a collagen disorder. So collagen can affect the whole body, okay? So basically, I've got Anne Sutherland mentioned here, okay? Anne used to be, maybe still is, the EDS Support UK Scotland representative, and I'm one of them as well. So I'll let you read that slide. You can have any of these things going on, okay? Anne says she's got everything apart from the heart valve problems. So you can see there's so much going on. So let's just move on to the next one. As well as having hypermobile Ehlers-Danlos, it can also be tied in with mast cell issues and autonomic dysfunction. We could do a 3-hour lecture on any of these. So I'm just going to throw in the names of this, and we can maybe talk about that another time. Neurodivergency, just because patients get diagnosed with one thing, it doesn't mean we should stop at one label. Patients are allowed to be greedy and have as many diagnoses as they want, okay? So neurodivergency, quite often when somebody gets diagnosed with attention deficit hyperactivity disorder, autism, they stop looking there. 75% of people with ASD, I believe, are hypermobile. Yep, and I have picked up a lot of the neurodivergent population that are actually undiagnosed EDS, and it makes such a difference to their lives, okay? So in EDS, you're 67 times more likely to be neurodivergent. I used to think neurodivergent was the first two here, but something like dyslexia, dyscalculia, they are neurodivergent as well. And I think there's probably very few of us are neuronormal. Yep. Jessica Eccles, she is an absolutely amazing woman. She talks about having Ehlers-Danlos herself. She is a psychiatry consultant, the south of England. If anybody else wants to know, Google Jessica Eccles because she's amazing. Okay. Another thing that we have here is sensory perception sensitivity. And Ehlers-Danlos patients can be very sensitive, and this is a recognised condition. 1 in 5 of the population are very sensitive, and when you realise you are very sensitive as a condition, it can explain an awful lot of your life. So it's that friend that knows everything without you saying. It's a bit like one of my dogs, my brown dog. He knows when I'm upset before I know I'm upset. They can sense things. It could be a full lecture, trying to talk about what is it these people and this dog is picking up, but they know everything. They walk into a room, they know what's going on. They get all your stories out of you just by you looking at them. Yeah. And as Anne and I used to say, because I'm highly sensitive, so is Anne, years gone by, we would have been witches and we would have been burned at the stake, but at least Anne and I would have kept each other company. Yep. Being extra sensitive, it can make your lives so much richer, but it also gives challenges. Yep. And we've got the princess and the pea story that is showing somebody who's highly sensitive there. Okay. So as we have seen, there's many ways to present as having Ehlers-Danlos syndrome, and this is a really good way to sort of show it. There's no two people are the same who've got Ehlers-Danlos, and no one person stays the same throughout their lives. So, you might know somebody who's got really bad joint issues like Jamil, but they may not have bad GI issues. I picked up a 19-year-old who couldn't go to the gym with his university friends because he would poo himself. Yep. Yep, I'm keeping everything confidential here. Yep. You might work with some people like this that might just not understand it. Some people have really bad fatigue, others don't. So remember, if you know one person with EDS, all you know is one person with EDS. So that's sort of the sort of chronic issues with Ehlers-Danlos. We can have some more, we can have other issues as well that happen acutely, okay? Patients with EDS, they can have bleeding tendencies. When I take their wisdom teeth out, they can bleed, like stuffed pigs, sorry for want of a better expression. We need to know that, so we need to look after them. Wisdom tooth surgery, that's not as bad as having your GI system open. So they can have serious intraoperative bleeds. So we need to know, we need the team to know that this can happen after trauma, after surgery, and the number of people that say after having a child they almost bled to death. And I say, well, that can tie in with EDS. Yep. And the more we can know who's got EDS beforehand, so we can look after these people. Aortic dissections. I'm trying not to talk too much here, but I'm 4 minutes behind, but that's okay. I had a patient a few weeks ago in another practice that I will not name. I'm being so careful to keep confidentiality. And this was a 25-year-old man who came in to see me to have his wisdom teeth out. He was very anxious. That was a sign. Now, let me just say as well, it's much harder to pick up men with EDS than it is women. So last year I picked up 120 cases, only 3 of them were men. Now, that raises the whole chat about how do we diagnose and how do we pick them up. But let's put that to the side for a minute. So he was 25, was taking wisdom teeth out. He was very anxious. The local anaesthetic didn't work on one of the teeth. And this is a lovely practice I work in. Jill is the owner, and Jill always comes around for a chat at the end because I finish maybe around about 2 o'clock. And I started, well, Jill, this guy didn't numb up, and I just want you to keep an eye on him. And I was just about to say, Jill, I know you think I'm crazy. And she said, well, Audrey, that's really interesting because his mother died several years ago when she was out running from an aortic dissection. And if we can pick these things up, absolutely wonderful. Collapsed lungs. I have never come across anybody with a medical history who says they have a pneumothorax that doesn't end up being undiagnosed Ehlers-Danlos. They can have bowel and uterine ruptures. The suicide rate is much, much higher in patients with Ehlers-Danlos. Another good reason why we need to know this. We need to protect everybody, look after everybody, reduce the suicide rate, okay? So, what a lot of people get said to them when they go to their doctors is, there's no point in knowing as there's nothing we can do about this. Well, that gets us all absolutely fuming. So there is nothing you can do to change your dodgy collagen, your poorly formed collagen at the moment, okay? But there's a lot we can do, and there's a lot that people do before we pick them up as Ehlers-Danlos. There's a lot of lifestyle measures. Linda Bluestein, who we mentioned before, she is a doctor in the States. She was only picked up when she was 48 years old. And she is so switched on. Yep. So Linda, as I said, got wonderful website, wonderful podcasts. And what Linda says is, she's got this men's PMMS. And what she says is, if you can make a 5% improvement on all these different categories, just think how much better you could be. So a lot of our patients, before they know their EDS, they do yoga, mindfulness, Pilates. They don't eat sugar. They give up wheat. They give up dairy. There's so much that can be done to make their lives better, strengthen their muscles, and then their joints are not going to ping out of place or get sore. So I think this slide is very important. The biggest communication problem is we do not listen to understand. We listen to try and reply. And how many people do you all know? You're trying to have a conversation. They're not listening to you. They are just getting ready to tell you what they know. And, sometimes we have to take a step back and just really listen. Because I can't remember who else said it was, but they said, if you listen to the patient long enough, they will tell you what is wrong. So, I mean, we need to do this in our personal lives as well. And I can be just as guilty as anybody else. Okay. An Edinburgh publication that came out in 2024 that I've cheated and I've used for the links at the end. what they say is there's an average 20-year delay in diagnosis. Yep. Now, my argument with that is this is only looking at Scottish people who have been diagnosed. Yep. So there's loads of people out there. The eldest I've picked up is 83, and she wasn't in the study. So the delay is much longer than 20 years. Yep. What happens in this time? Patients are gaslit and they're just left hanging. They're told, you can't have this wrong with you. You can't have acid issues because you're too tall and thin. You know, you're far too healthy to have reflux issues. You were in last week for your shoulder, now you're in about your gut issues, and now you say you're anxious. There's nothing wrong with you. It's just you're going through a bit of a difficult patch. They are made to doubt themselves, and they become more and more unwell as time goes on. There is long-term physical and psychological harm. So this is why we need to pick cases up early, okay? And, you know, Anne, when she comes on the talk, gives an absolutely brilliant talk on this. You know, there's just so much harm that's done. Yep. Unnecessary appointments, investigations, treatments and medications. The Edinburgh paper said by the time this group of patients were diagnosed, their hospital appointments went down by 50%. Now, Emma doesn't mind sharing with us. She has had scopes in, down, round, in and out everywhere, MRI scans, CT scans. And, you know, Emma will be the first to say it was a complete and utter waste of money and time, because if they could have just known her gut issues were EDS, it would have made so much more sense. As I said, it's a waste of money. And then there's the toll inflicted on individuals, families and workplaces. We could talk forever on this. We really, really could. So how do we diagnose EDS? Ehlers-Danlos Society, they have got ways of looking at it. They are going to update this next year. None of us are really very happy with the way we can diagnose, because a lot of patients fall through the cracks and they don't actually get a diagnosis. So this is a busy slide, but basically there is a diagnostic sheet for hypermobile Ehlers-Danlos. If you fulfill the criteria, fine, you're diagnosed. If you don't, you can then be diagnosed with hypomobility spectrum disorder. And you can look at that later and whatever else. But myself and a colleague, Janet, also EDS allied clinician, we can find it very, very frustrating, because I've now got this sixth sense because I've picked up so many. I just feel they are EDS. You know, you don't have to be overly bendy. But anyway, yeah. So Baton classification, talking about being bendy. Okay, the Baton classification is out of 9. And for an adult, you have to score 5 out of 9 to be overly bendy to have Ehlers-Danlos, or if you're over 50, 4 out of 9. Nobody in the worldwide consortium of EDS is all that happy with this, because it's only looking at certain joints, and we do pick up people that are not overly bendy, but they definitely have the genes. So Alan Hakim, who I spoke about before, Alan will be the first to say that if you're not overly mobile, you do not get let into the party, and this is wrong. So Alan Hakim and Rodney Graham, they made another questionnaire out of 5. You've got to score 3 out of 5 to sort of fulfill the criteria. Again, it's not perfect, but I think there's an 85% tie-in rate that if you do answer 3 out of 5, you're likely to be. And it's all about bringing your thumb back to your wrist. Yeah. Anyway, we can talk about it more later if you want. So don't be confused. I know this is all confusing, but we're here to talk about it. So there's other complicating factors. So don't be misled. The diagnosis can be missed, and don't stop at one label, as I said before. So long COVID, you have all probably heard a lot about after long COVID. So after COVID, you can get long COVID. I showed a slide about POTS. That's postural tachycardic syndrome, and that is when you stand up, you can feel faint. And a lot of people after long COVID are getting diagnosed with POTS. Yep. But what a lot of us think is a lot of the long COVID cases are actually undiagnosed Ehlers-Danlos. The Lyme disease is the same. Is it you get your virus, and it just tips you over the edge, and then all your symptoms just flood out and become too much to manage. Another time we can miss the diagnosis is when your hormones are changing, puberty, pregnancy, women at a certain time of life. Yeah, that is too easy to say women in their 50s. Oh, it's just your hormones. That's why your joints are sore. That's why your migraines are worse. It's a little bit to do with your hormones, but you've got the underlying connective tissue disorder. Okay, fibro and ME, you know, that's a big, big subject. Again, I was saying to Linda, you know, I'd read a paper, I thought, that said 85% of patients with ME, or was it fibro, can't remember, sorry, were actually undiagnosed Ehlers-Danlos. And she said, Audrey, I don't agree with you. I think it's 100%. Yep. Other traumas or life changes. It just tips you over the edge when you were managing just to hold everything together. So let's move on to teeth, another dog photo, okay? Those teeth probably need a scale for all you therapists and hygienists looking at that. So let's move on from that attractive looking young man. So local anaesthetic, they can have difficulty with local anaesthetic. I have it as one of my set questions when I'm taking the history, asking them about local anaesthetic. I don't ask once, I ask them 3 times, okay? So you can tell a lot by how somebody answers the question. You know, do you go numb when we numb you up? Yeah, that's not convincing to me. Or what do you mean? Well, the dentist tells me I go numb. Okay, well, I'm not interested in what the dentist or the hygienist says. And then, do you go numb? Well, I get a numb lip. It's like, I'm not interested if your lip goes numb. And you pin them against a wall and say, do you feel this sore? Yep. One of the worst ones I found was a newly qualified dentist. And she thought it was normal to feel pain at the dentist because that is what she felt. She felt her lip was numb, but she felt pain. So I cannot stress enough, ask them if they go numb. A good question for young ladies with the contraceptive for going numb is because a lot of youngsters haven't had any local, is, you know, you can have a contraceptive rod put in your arm and you need to be numbed up for that. Out for a walk with a GP friend of mine telling her about all this, she stopped walking and she looked at me and she said, do you think that's why I can't get some of these numbed up, Audrey? I think, yeah, I think it is. Yep. So ask that. Dental and oral issues, they can be anxious. I now see being anxious as very, very different than I used to. It is the way your brain is made. It's not just them being stupid. I never really thought that anyway, but they are anxious. They're more sensitive, they're anxious, and they're probably much more anxious because they've been gaslit and everything else through their lives. So, you know, we need to manage their anxiety. Because I've done this for a long time and I'm so clued in with it now, and I work with such supportive teams, which I'm so lucky about. That's why I'm pausing. We can manage the patients being anxious, even the ones that come in saying they want sedation. We don't even need to try. So you need to start this with the dentists who are sending you these patients, the reception staff booking them in, the nurses, the managers, everything, and you need to sit and listen. These patients with EDS, they just want to be listened to and understood. Yep, and we can work around them. They can bruise easily, they can bleed easily, and they can have fragile tissues. So if I'm taking out wisdom teeth, I will pack the socket with a hemostatic agent. Yep, if I suspect they've got Ehlers-Danlos. For Ehlers-Danlos patients, when I put my scalpel in to raise my wisdom tooth flap, even 2 of my nurses will say that they notice when it's different. Yep. For you guys doing all your scaling, for your PMPR, it's now called. See, I'm up to date, guys. You maybe notice as well the gums bleed much more than they should. It doesn't tie in with the amount of plaque there. Things bleed much easier and they bruise easier. Once I had a patient, I took an easy wisdom tooth out from bleeding down to the middle of their chest. They'd bruise easily. They get TM joint issues, yep, facial pain, they can have a high arched palate, muscle tiredness, MIH. They can have pulp stones, which makes doing endo a little bit more tricky. They can have torridism. They can be very sensitive. So speeding on, this is the best paper we've got on the problems with numbing patients up at the moment. Alan Hakim is on it, Claire Francomano, who's on the international consortium meetings I go to once a month. She's a geneticist. These are all brilliant people. So what this paper says is it is a retrospective study. It's not brilliant. The people that wrote it say it's not brilliant, but it's the best we've got at the moment. So in patients with EDS, 88% of them have inadequate pain control as opposed to 33% of control patients. And these are the local anaesthetics that they say work best. So the most common one, 8.1%, articaine, 30%. We need much more research on this, but you know, this is what we're sort of working on at the moment. Why doesn't it work well? The paper says it might be due to mast cell issues, abnormal connective tissue, or altered pain pathways. Yep. Just to say a little bit more on this, some people say, how do you get your patients numb, Audrey? And I quite often look at my nurse and say, I don't know. And one day, Ray, my nurse who I work with, we started chatting about it, and we think it is because we listen to them. And also because occasionally we have the manager or another nurse come in thinking there's something wrong in our surgery, because the three of us are just about rolling around the floor laughing. And laughing actually resets your nervous system. Also, I will encourage people to have a really good cry. Yep. I'll say, we're not giving you a box of tissues, we're giving you the big hand roll because we want you to really get it out of your system. That resets your nervous system and probably helps you to go numb. Yep. We had one patient, Birdie, who was a great patient. Shame she's not here tonight. Shame I can't tell you more about her, but if you want another talk, we could have another talk, Siobhan, with just me and the Ehlers-Danlos patients, just all talking about their issues. Birdie, when Ray and I were taking out her wisdom teeth, decided to hum. And so she hummed, and Ray, my nurse, and I had to guess the tunes she was humming. And afterwards, I said to Janet, who's my colleague in all this, I said, you know, if Birdie was humming through this, and she said, yes, Audrey, this is like the yoga humming and the breathing, and it helps to reset your dysautonomic dysfunction. So it's just brilliant, the things you can learn in this. They have a lot of TMDs and facial pain, often undiagnosed EDS. It's very relevant to the management to pick up the EDS. Quite often I'll get the TMDs in to see me and they're busy telling me about their TM joint pain and this and that. And then I'll say, excuse me, do you have any neck, back or shoulder pain? And they have got to the stage in their lives where they've not been believed. Nobody wants to listen to them. The oral surgeon is the only one that'll see them now. And they don't think anything is relevant from the neck down. And by the time you get into it, everything else in their body is so much worse than their TMD. And they're just very pleased to talk about it, and then we can get them proper help. I also see the way that TMD pain goes is you cannot separate it out from the rest of the body. Everything is connected. So if your lower back is out, if your hips are out, if one leg's longer than the other, if you've got a scoliosis, that is going to affect your TM joint. And a lot of the time, if we can get the lower back, upper back, everything sorted, their TMD settles. Yeah. So we need much more awareness. Yep. People with EDS, 75% of them have TMD compared to 25% of the general population. Okay. What I do when I suspect, okay, I say to the patient, I'm not telling you anything you don't already know. All I'm saying is, do you think this could all be connected? Yep. I have an extended medical history questionnaire. I will share with you all, and it's all on our Facebook page, and it's all in a slide here. I will share with you everything I've got on this because we can't be precious over it. We want to share it. Extended medical history questionnaire. It's now called an EDS-MEDS. So we just say to the nurse, can we have an EDS-MEDS? Yeah, we fill that out. It takes maybe about 15 minutes, but it's like, you know, do you have gastric reflux? Ah, well, now I want to know, do you ever have it? Tell me. Do you have gut issues? Oh, well, it's only when I eat the wrong. I'm putting that down as a yes. You know, so you need to just go through this because I think all of us are guilty. You know, if we go to have an eye test or to the dentist, we think the dentist doesn't really need to know that. I say, have you considered everything's connected? Remember a differential diagnosis. So, you know, this could be hypermobile EDS. It could be one of all the 300 other connective tissue disorders. Most people have been looking for answers, and almost everybody welcomed the information. Then what I do, I've got a link of things I email them that they can go and read up. That can all be yours, guys. There's a template for a letter to their doctor and to any specialists. Refer on to who we want, or get the doctor to do it, whatever, okay? Give them EDS Support UK information and the Hypermobility Spectrum Association. And remember to deal with the issue that they came with. So what I ask you all to do, GDPs, hygienists, therapists, and I need to change that, sorry, that heading there. Look for cold hands, younger looking skin, anxiety. They have cold hands because of their blood pressure issues and their POTS. Yep. I shake everybody's hand when they come in and you think, oh my goodness, your hand's a bit cold. Yeah. See all the medical history as relevant. Okay. Stop this. We don't need to know that. Get it all down. Encourage them all to get it down. Ask about local anaesthetic issues and easy bruising. See the case as a whole holistically. Yep. Alan Hakim has asked me to help him run between North America and here an EDS Echo course that will be 15 CPD points. We're hopefully running that in 2026, and that would teach you so much more of all the things that I've mentioned to you today. Okay. So the summary really is, these conditions are not understood well, and the incidence is much greater than we thought. We need to be able to identify signs and symptoms. Many considerations for treatment. And I know that was a whirlwind way through it, but you know, if you can imagine all those different things wrong with somebody, every patient with EDS is different, changes through their life, and the dental team has a huge role to play. We can pick these cases up, we can pass them on to their doctor, direct them for help, and it's also going to make a huge difference to the treatment you're giving them. Okay. You know, as you know, therapists, hygienists, their gums are going to bleed easier. These are going to be the people that are highly sensitive as well, and they're not going to like that slightly off shade of your composite that nobody else can notice, and there's just a huge load going on there. So what now? We're trying to get the knowledge out to as many as possible. Medical dental schools. We want an assessment tool for dentists, which is what I'm sharing, the EDS pack. We're trying to get it out to the International Oral Pain Group, the TMD Get It Right First Time Group, British Association of Oral Surgeons. We've spoken to all these people, and we're trying to get Scottish Dental Clinical Effectiveness guidance. They turned me down this time, but we're going to try again. When I first started out these talks, during lockdown, must have been about 4 or 5 years ago, I had no idea we could reach as many people as we have reached. We've now reached, I've given up counting, we've probably 6,000-7,000 healthcare professionals that we've reached with this now. And the number of people that we're picking up is just absolutely astounding. And I have to just thank everybody that helps me with this. And we need research, publications. So this is what you can get is our pack to identify, you know, and to help. This is probably not up to date. It's up to date on my OneDrive, and I can share all that with you. If you need help, you can speak to me. There's my email address. If you just Google Audrey Kershaw, Oral Surgery Scotland, you'll easily find me. The EDS helpline, the Hypermobility Spectrum Association helpline. As I said, we always find people on these talks that have issues. Message me. I'll check my emails later. Don't feel alone, because we're here to help you. So thank you for listening. Thanks to our speakers. I feel quite exhausted, like these two dogs. We'll take questions, but these are just some references. I don't know if that could be shared with the group as well, or you can all take a screenshot of it. So Siobhan has asked me to pop this up as well. I'll just go back in case anybody wants to take a screenshot of that. They can get it back on playback anyway, Siobhan, can't they? Yeah. So,
yeah, definitely. Yeah.
So that's great. I hope that was great.
Thank you very much. Wow, that's a lot of information, isn't it? And yeah, a lot to think about, Audrey, and we definitely need to read around more. I just want to point out that I have put your email into the chat. I've also
Wonderful.
put a Facebook group into the chat, so if anybody
Great.
would
I'm
like to
just looking
join
at
that to
that.
know more.
Yes. Uh-huh.
Um,
I'm just looking at the questions here. Jessica Davis says some patients have a very real heightened aversion to what's electric toothbrushes. They often say they feel like they're taking their head off. I believe this is a real thing, but never found a related cause. Oh, absolutely, Jessica. Would be interested to know if there is another observation in EDS patients. They are very sensitive to everything, Jessica. Yep. But I think if somebody wants to get used to an electric toothbrush, they just need to do it for a few seconds at a time, put it on the lowest setting. If they want to get used to it, they might be able to get used to it. And thank you, Gillian, for saying thank you so much, Audrey. It was very interesting. I don't know if you guys realize how difficult it is to come up here and give a talk. And sometimes it can take me 3 weeks to get over a talk, depending on how it's gone. I think that was maybe the talk where we had IT issues. My brown dog was dying in the middle of it. I'm not joking, dying. So thank you for realizing how difficult this is. Sometimes we have people on that don't really believe it. So thank you for your comments. So where are we here? Jessica said that. Siobhan's put something in. Gillian Mitchell, thanks. Zaina, this has been amazing. Listen to this. Oh, I have a few people coming to mind. That is what happens. You have a few people coming to mind, and I hope you can go back and help them, Zaina. Yeah. But one for certain who I'll speak to about this evening. Okay, this is maybe a friend or a family member. Zaina, I'm here to help as I can, okay, because this has taken over my life. It's the I can't say that name easily. Ikigai. This is my Ikigai,
Ikiga.
yeah. Nina, thanks for your comment. Anita, I think you're up in Aberdeen. Nice to see you there. Brilliant. Thanks. Thank you so much. Thank you. Anybody got any other questions? Kelly
We
had.
do, yes, we have. Can we please have the slide with the symptoms on the screen again? We'll share that in a minute, just giving everybody a chance to do the CPD certificate at the moment. So
All
Anita will
right.
definitely come back to that one.
Yes.
Thank you. I will see EDS differently and will be extra vigilant from GULAB. I can't see the link to the Facebook group. I'll put it back in now. It was
Thank
right at the
you.
beginning and we've
I
gone down quite far.
okay.
So I
So
will
we've got
drop that in now.
Michelle saying, Michelle saying thank you. I have patients who will benefit. Do you think they need to see me, Michelle, or can you manage them yourself? I wonder. Can't see the link. Yeah, we'll get that. Lots of wonderful info. Thank you, Martina. I also have a family member in mind, and this might prevent her from going round medical professionals. Martina, I'm here for you all, okay? Please message me and tell me how many you found, yeah, and if we can help. Now, what I should have said to you all was it is really difficult to get help. I know I said, oh, you just refer the patient to their doctor. Most doctors are going to say, nah, there's nothing wrong with you because they don't understand. You're not ill enough. You look too well. Your joints are not overly bendy, or you don't have enough of other things going on. You will hit brick walls. So reach out to me and we will try and help you, okay? I have got a little system here sorted with a private osteopath in Scotland who I'm not going to name. And we've got an absolutely wonderful setup going on. She can diagnose. And I've flooded her. She's closed her waiting list several times. But it is very, very hard to get the right help. So for all of you saying that you know people, please reach out if we can help and we can try and direct you. Very hard to get help on the National Health Service. Those two dogs of mine, they're not just pretty faces or cuddly, cuddly little things. They help us in many, many different ways. They have been to the Scottish Dental Show last year on our stand, pulling in people to get them talking about EDS. They have also got a member of the Scottish Parliament's PA in for a cup of tea because he liked poodles. And I said, right, now that you're sitting in my bay window with a dog, can we get this through the Scottish Parliament for better health care? It is now gone to the third stage of the Scottish Parliament to try and get this through for better health care. And we are doing everything we can to do it. So if all you guys can help me, if you can join me, we need everybody on board. And I had no idea, you know, a few years ago we were going to get everybody believing this. So Anne-Marie Yarwood, learned so much. Thank you, Audrey. Certainly be thinking more broadly, more open to signs and symptoms. Yeah, so that's brilliant.
Then I have thank you so much. I have EDS, and I often wondered why I have acute sensitivity to certain things, but very tolerant to pain.
I'm not finding that one there. Have I missed that?
So we've got questions and answers, and we've got chat.
Oh my goodness, I'm not clever enough. So where would I find the questions and answers? View. Yep.
Well, I can just call them out to you.
Oh
So
yeah, no, that's fine. Okay,
somebody's just
please.
saying thank you so much, and then what are the treatment options?
As we said, I think I've got rid of my screen there, but hey, sorry about that. No, we can go back. Oh, who knows? Right, I've got rid of my screen. I'm sorry about that. What are the treatment options? As I said, we cannot change your collagen at the present time. So we need to decide on what's wrong with you, okay? So, for example, if we take the POTS, the issues with the low blood pressure and the feeling faint if you stand up too quickly, yep. Things that can make that better. You have got to have enough fluids. You have to increase the salt in your diet. You have to get physically fit because if you've got strong muscles, that's going to help the blood back up. If you are on a very low GI sugar diet, that is going to help as well. So you cut out sugar. And a lot of people with EDS, they've already done this and they don't know why they've done it. So these are the difficult members of staff who will not have a bit of the chocolate cake you've made because they won't feel well afterwards. So diet, fluids, exercise, sleep, mindfulness, meditation, yoga, everything is tied in. Everything is tied in. We can then move on to the different drugs that you can have to try and raise your blood pressure and whatever else. And that is just us talking of the POTS. Yep. If we're talking about the GI issues, there's just so much else as well. Yep. For example, the acid issues. I've learned so much about this. So what I didn't manage to share during this talk, Siobhan, I don't know why it didn't come out, is I've got Ehlers-Danlos. Okay.
Okay.
And I only came out when I was on a Jazz Gulati podcast earlier in the year. This isn't about me, yep, but this is about patients. So, but I'm sharing I've got it. So I don't know how old people think I look, but I'm in my 60s. You know, people sometimes think I look younger. Yeah, I am very sensitive. I'm not going to go through all of my health issues, but I picked myself up when my friend said about it when I was 53. I suffered my whole life. So for things like the acid issues, the reflux, you should sleep on your left side because your stomach is such a shape that if you're on your left side, things are going to stay in. If you lie on your right side, things are going to fall out. So even just a small change like that, you shouldn't eat after a certain time of night. There are certain foods which have naturally occurring muscle relaxants in them. So things like tomatoes, mint, garlic, onions. They will relax your sphincter muscles. And so your muscles will not be tight, holding the stuff in your stomach. So there is so much that we can do. So we need to decide what it is you're wanting help with. You know, we should maybe only tackle one or two things at a time because trying to tackle everything at once would be too much if you've only just realized, yeah? So I hope that answers that question there, yeah? So that's my email. Thank you. The quickest hour, very easy to listen to you. Thank you, Alana. Thank you. I can't find where to complete the CPD questions.
Yeah, I've been
Don't worry.
sorting that.
I
And
might
you
send you.
can't get the symptoms page back up, can you, Audrey?
Tell me, I'm useless. I'm useless. How do I do that?
Where's your presentation gone?
I don't
Well,
know.
I'll put your email in here and
I don't know. I don't want to.
don't worry. Don't
It's
worry.
special.
We can
I
just put your
think we did
email.
so well, Siobhan, to have that working
I
well up
know.
until now.
I
Um,
know.
Yeah, sorry, I don't know. If you can help them, that would just be brilliant. There we go.
Yeah.
What is it? What is it you're wanting
The
up?
symptoms page.
Symptoms page. Oh, I'm doing well here. And we also have to thank that helper we had earlier on, Siobhan, who was dragged in from
Absolutely.
fixing his bikes to the symptom page, the picture. Okay. Can you see that fine there? Is that showing
Is
up,
that what you
Siobhan?
were looking for, Anita? Yeah, you can take a picture of that if that's okay, Audrey.
Oh, absolutely.
Yes, thanks. Yeah, she's got it now. Is everybody okay with the QR code? And the QR, did you get the QR code? And then the link is in the chat. You might just go back to the QR code if you don't mind, Audrey.
The QR code, I might manage that.
Right at the end, yeah.
Great.
Yeah.
Yep.
And I've also, the link is where? It's in the chat. So you can just press on the link in the chat, or you can, if you have your phone, you can take a photograph and then it goes into pictures, photos, and you can just press on it and it will bring you through to answer the questions. Or you can just put it in your camera now and do it straight away. And then the certificate will go into your inbox, but also check junk and spam just in case.
So has someone still got a hand up there? No,
No, not at the
no,
moment.
that's fine. I'm
No.
just
I'm
having a
just
read
going
of
to
all
put
the
the link in
names.
one more time.
Yeah, see if I know any of you, because I mean, you've probably all just come from, I don't know where you've come from,
All over.
all over the
We have,
world or
yeah.
all over the world. Oh my goodness me. Yes,
And
brilliant.
this will be available on demand in about 7 or 10 days because a lot of our colleagues work late evenings.
No,
So that
that's brilliant.
it's nice to give
I'm
them the opportunity to watch it back.
just very grateful. I'm very grateful, Siobhan, that you've given us this chance to spread the word. Yeah. If any of you are from Scotland, we have got a stand at the Scottish Dental Show again in 2026. This year I didn't take the poodles, and Anne, who organises, said, "Where are they?" So the poodles are coming this year
Oh,
again.
Anna's brilliant. Yeah.
If any of you want talks to any of your practices, or you want us to come anywhere to give this, we will do anything to do this. If you ever wanted another talk, Siobhan, I could get 3 or 4 patients together and they could all come and just talk about what it's like. Yeah. But I think looking at people that are here tonight, we've probably got enough people who are maybe thinking they've got Ehlers-Danlos. We could manage that ourselves, yeah? Still cannot
Yeah,
see
everything's
the
gone
link.
down the chat. Let me just try and see if I can get the Facebook link again. Or if you scroll right back down to the very beginning of the chat, I put it in there earlier.
So me,
I'll just see if I can get it again.
oh, yeah, that's not showing up. That's on my other screen. Sorry, yeah. So what were you putting up the link
Do you
to
know
the
what I'll do?
face?
Yeah,
Yeah,
I'm just looking for the
is
Facebook. Would
that's
you
what they're looking
scroll
for?
right back down to the very beginning of the chat? And it's the first link that's in the chat there. And it just won't let me copy and paste on here for some reason.
So are you talking to
Again,
me there, Siobhan, or are you talking to the other people?
just talking to somebody that's
Yeah,
looking
no,
for
no,
the
that's great.
Facebook
I wondered
group.
if I had to do something there. Yeah.
That's okay. And our email is nskikigai@gmail. So if you're missing anything, just email us. Oh, I can't scroll back due to joining late. Okay. Let me just see if I can get it for you.
If anybody has trouble with the Facebook thing, just go for Audrey Kershaw on Facebook, ask to be my friend, and I can get you on as well.
Okay. I have a link here now, so I'll pop it in here. Let's see. Can you get that now? So that's the Facebook. Yep, you've got that now. Great. That's good, Zoe. We got it, the Facebook link and the QR code for your CPD. And please remember that because this is education, NSK offer you 40% of any NSK products. And that's the code there, WAK01025. So take a picture of that and you go to the NSK shop and you can use that. So that's NSK's way of just saying thank you for joining us for education. Audrey, that was a busy one.
Well, thank you for having me.
Thank you so much. I think we'll definitely have to bring you back again. And
That would be
you have
brilliant.
Audrey's email. And yeah, thanks, Anita, for coming. And Anita's in the US now, Canada, aren't you, Anita? So that's fantastic. Perfect, thanks. I have more sympathy for my colleagues and patients now. Well, that's nice. Oh, Canada, yeah.
Have you moved there,
Scotland.
Anita, or are you just visiting? No, she must just.
She's relocated.
Oh my goodness, you're
And
away
she
from.
was that person that was looking after us, doing all the exercises and keeping us healthy.
Oh, I didn't know you'd
Be a
gone.
good
Right.
connection, actually. Yeah,
Yes. Well, you can still be in Canada, Anita. You can spread this word in Canada. I'm here. I'll do you
absolutely.
whatever webinars you want in Canada. Yeah. Please.
Right. You should collaborate.
You give me a shout, Anita. Anybody, give me a shout, whatever countries you're in. Yes. Uh-huh.
Okay.
Brilliant.
Audrey, thank you very much. That was
Yep.
fantastic.
Thank
I
you.
think people will definitely want to watch that back on demand and pause and take some notes. And like I say, we'll have to have you back again. And thank you very much for giving up your evening.
No, thank you. And I wish everybody a good rest of your evening, okay?
Thank you very much.
Thank you.
Bye,
Take care.
everybody.